Hi, good afternoon, everyone. This is Gagan Bhalla. Welcome to this panel. The point of this panel is to have a focused discussion on what India to 2030 will look like from the point of view of a science-based integrative approach. I am delighted to be a part of this panel. I have a few esteemed colleagues with me. I'll do a short introduction about myself and the panelists that are on this panel with me. And then we will get into sharing our points of view and then invite question and answers towards the end. So like I said, my name is Gagan Bhalla. I have been in the healthcare industry for about 20 years. I've been fortunate to have been part of the healthcare industry, both in the United States and in India. I've had some good chances to work across the payer-provider spectrum. This has included recent stints in India as the Chief Operating Officer for Max Bupa, the health insurance company, and then the Chief Executive Officer for Apollo Sugar, which is a company which was a joint venture with Apollo Hospitals and Sanofi Pharma and was focused on a chain of diabetes clinics. More recently, I have become the founder and chief executive for a company called Exacta.health, which is focused on the intersection of health tech and what big data and analytics can mean for the world of healthcare. So that's a short background about myself. I'm also joined on this panel by a few esteemed colleagues who are representing here. Dimple Parmar is the co-founder and chief executive of Integrative Oncology, which is a cancer startup called zenonco.io. We also have on the panel Bhargav Sri Prakash. Bhargav is the founder and chief executive of Friends Learn, a life science and health technology startup which is based in San Francisco, California. And we also have Rajiv Vasudevan, who's the founder and chief executive officer of Ayurved Hospitals. So with that, we have a great panel assembled here on a good topic. So without further ado, I'd request maybe the panelists, if you can say a few words about yourself. Dimple, how about we start with you, then Bhargav, and then Rajiv?
Sounds good. Thanks, Gagan, for the wonderful introduction. Hello, everyone. My name is Dimple Parmar, and I primarily work with cancer patients, and that's where we use integrative oncology. My journey with cancer started 3 years ago when one of my friend was diagnosed with cancer, who became my husband later. And through that, the entire journey started where we initially focused on the medical treatment. But when the disease spread, we started exploring more options, took him to US for advanced treatment. And that's we understood what all things can be done when it comes to a terminal illness or a chronic illness like cancer. So we came back to India, started Love Heals Cancer. That's a non-profit venture to support cancer patients. But soon we realized that it's a very widespread disease, which is happening almost everywhere in every family. So how can we create something which is much more impactful, meaningful, sustainable, and scalable? And that's how we introduced me and my partner Kishan. We both started zenonco.io, which is world's first integrative oncology health tech cancer care startup. Vision is to save lives of cancer patients, and mission is to make integrative oncology accessible and improving quality of life for cancer patients. Thank you for the wonderful opportunity, and happy to share my learning and insights of last 4 years in the field of integrative cancer care. Thank you so much.
Thank you, Dimple. That's wonderful. Thank you for joining us. Bhargav, would you like to introduce yourself?
Sure. No, thanks, Gagan, and thank you for having me. It's a great pleasure and honor. So I run a company called Friends Learn. We've been around for about 10 years, and we're focused on vaccine technologies. It's a project that we're translating research that we've been undertaking at Carnegie Mellon University in Pittsburgh, and also in collaboration with folks from Stanford School of Medicine and the Bloomberg School of Public Health at Johns Hopkins University. It's an area of, I guess, a new modality or a novel way to try and prevent disease. Our focus has been on pediatric population, and we are creating kind of a new approach using computing and neurocognitive computing, so non-invasively preventing disease. To give you some background, I've been my own background. I'm an engineer by training, so I come to medicine and vaccines and prevention technology with an engineering mindset and a deeply kind of problem-solving mindset as an engineer. This is triggered for me personally after becoming a parent and starting to think about future generations and children's health was kind of what led me to this decade-long journey. But I've been an entrepreneur since the beginning of my career, and was able to build and sell technology companies, and also was in finance. But this is really a calling to try and see how we can protect health of future generations using non-invasive, technology-assisted vaccines that can prevent a lot of disease. So would love to tell you more about it and have this conversation. Thank you again for having me.
Thank you so much, Bhargav. I think the most overused word in the world today is vaccine, and digital vaccine is, I think, a great idea. We look forward to hearing more about that later in the panel. Rajiv, welcome to the panel. Can you share your introduction, please?
Thank you very much, Gagan, and thanks to IIT Bombay Alumni Association for arranging this very interesting topic and this panel, and delighted to be part of this. So we founded Ayurveda Hospitals. I founded it about 15 years back with the clear vision to contribute to the mainstreaming of Ayurveda medical care. And the reason that we looked at this was very clearly there were gaps in the healthcare spectrum of services if you look at it. So beyond the obsession with tertiary and quaternary medical care, if you look at the phase of medical care preceding it and succeeding it, in both these respects, it was quite evident that the entire industry and government was also quite lax in looking at the need and need fulfillment. So the other part was that we found that Ayurveda could be completely process-driven and completely protocols-driven. So it gave a very good opportunity for a scalable, replicable enterprise. And we saw one more trend, that insurance is increasingly looking at, the payer is looking at including Ayurveda in the scope of care. So when you looked at that, merging protocols-driven, serious medical care, not the casual, transient wellness type of therapies, but the serious medical care, tertiary Ayurveda. And then looking at a model very succinctly, a model which allows long length of stay, where ALOS can be as high as 20 days, 28 days, in a low capex model, high knowledge model. So knowledge intensive, not technology investment intensive. Look at a new way to construct a healthcare enterprise, which is scalable, replicable. And I think we have now got a profitable model, which is spanning 4 cities and 4 states today, which also does appropriately integrated medical care. We'll talk about that in due course as we get to this topic. So delighted to be here, Gagan, and look forward to the discussions.
Thank you, Rajiv. Thank you so much. That's a fascinating journey. So let me take a few steps back and talk a bit about our topic, and then maybe open it up to all our panelists' views. So we are supposed to discuss what healthcare 2030 in India will look like, specifically from the line of sight of a science-based integrative approach. Now, I think we have a fascinating, panel here with people representing Ayurveda, people representing diagnostics, digital vaccines, and the allopathic model of tertiary care on hospitals and payers, providers, but also what data could do to help make this an integrative approach, not just an integrated approach. I think one of the panelists, Rajiv, specifically said this, which was a very great way of putting it, that it has to be integrative, not just integrated, right? And I think as we look to our nation and look at the problem of healthcare from 2021 to 2030, there are both some exciting trends and some scary trends. And I'd like to spend a minute just on both of them. The scary trend is we are going to be a nation of 1.5 billion people by the time it's 2030. That's not a trivial number. So we're going to add lots of hundreds and hundreds of millions of lives to this nation. We all know the numbers in terms of, we don't have enough physicians, we don't have enough nurses, and so on. So I won't bore you with that. So you have a situation where demand is already outstripping supply, and demand is going to even more quickly outstrip supply, which fundamentally calls for more, intelligent, smarter, and integrative approaches, to healthcare. So that's something that we should keep at the backdrop as as a scary number that the nation is facing. But we also see some very interesting, macro trends and micro trends, right? So we are hearing about digital vaccines from one of our panelists. We are hearing about Ayurveda and the successful of tertiary Ayurveda and how that could be a very scalable, process-driven approach. But equally, credit be given, the government is doing, in my view, a fairly interesting experiment and a scalable model, or at least encouraging a scalable model, with what the National Digital Health Mission is going to do, right? Those of you who are familiar with the National Digital Health Mission, this is India's, Aadhaar card infrastructure thinking and inspiration applied, in the context of healthcare, which is a multifaceted industry with, payers, providers of all hues, right? There's no such thing as one type of provider in India, right? And I feel that the National Digital Health Mission infrastructure is a very interesting way to start, scaling up some of what India will need to do as a model economy in terms of healthcare. So I just wanted to, set some context, on that. So we are going to talk about integrative approach to healthcare, science-based approach to healthcare, all with a line of sight to 2030. So with that, maybe I can request, maybe Rajiv, if you'd like to go first, would you like to share your views with our audience?
Thank you, Gagan. So let's begin with the term integrative itself, because it means different things to different people. And therefore, it's very important to look at stages of disease and stages of care. Because when you talk about diabetes, you have anywhere from pre-diabetes to diabetic foot, diabetic nephropathy, the entire spectrum. So when you look at stages of a disease is one part. And even when we look in the context of prevention, that word is oft misused, because what we consider prevention is actually only primary prevention. Whereas if we look at primary, secondary prevention, tertiary prevention, it totally changes the way we look at healthcare services. So in this context, integrative means one very specific, has a specific connotation, which is people with multiple comorbidities. Today, if you were to look at the profile of people and the healthcare demand, and those of my colleagues here who are, serving different segments of customers, will find one person coming for a diabetes treatment has got 4 other comorbidities. Somebody with Parkinsonism has 3 other. But I look at it from a unidimensional perspective and say that I'm treating Parkinson's, treating diabetes, which is, of course, completely suboptimal. So what does integration do? Appropriately integration for a particular disease at a particular stage, I may say, let me go with modern medicine. For something which is at a very early stage, I use diet, lifestyle, some coaching, something, try to reverse it. The third thing is Ayurveda can come as a primary thing. And 4 would be bring in 2 modes and wean off the person of one system gradually because the other system is superior. So this type of one place where you look at multiple experts coming in is one way to define it. The other part is the use of technology in any system to do risk mitigation, risk assessment. This is also appropriate integration. So diagnostics are part of that. But we need to understand that today, 2/3 of healthcare burden is coming from people with chronic diseases. And that means that the healthcare burden is increased so systematically for people with one condition for more than 3 months, which is the WHO definition. That being the case, it subsists because we're treating the symptom of the disease and not the root cause, right? So we totally ignore this. We're just talking about disease, healthcare, and evidence-based, science-based, but we're treating the symptom. When you get to treating the root cause, we need to understand it is a systemic issue. We're going from nutrition, we're going to environment, pollution, occupational stress, environmental stress, all kinds of other factors are coming, right? So we take all this, and the food chain, today the food chain is totally polluted, right? Whatever we eat. So we are ignoring this at our own risk. And we are looking at antibiotic microbial resistance, spurious drugs. So it's a systemic issue. And today, with the internet being there, health education is totally in a mess, because anybody, right from a Baba to a Babu to a ICMR, you cannot believe anybody. because everybody is talking something which is truly today suspect. We don't know what is believable. Fragmented care. So in this scenario, you talked about a 1.5 billion people, but I want to tell one thing. India's scenario in 2030 is going to be very different. The 4 southern states, we referred to that in an earlier conversation, will be probably going at a 5% population growth, whereas the others will be going 20%. So you're going to have total disparity of demand and supply, payment capacity, and this thing. In this scenario, you're going to see Ayushman Bharat today, which is covering 500 million people, going above the poverty line, covering the middle belly, which is about 200, 300 million, and then the paid insurance coverage, guys. So with that, you get universal health coverage. What is that going to do, right? So we have to understand that this model is going to undergo a tremendous change. 150,000 doctors a year. And today, the scenario is that many doctors are unemployed, underemployed. So in this scenario, how do we look at an NDHM? You talked about aligning center state. There are multiple systemic issues. Therefore, I want to come with the point that in this whole scenario, Ayurveda plays an extremely complementary role. And when I say complementary, it does not mean a subservient, subsidiary role. It is a core role which complements what is happening in modern medicine. In that, when you look at the spectrum of preventive, curative, promotive healthcare, right? When you look at primary care to rehabilitation, the earlier discussion, one of the panelists, people said, there's no incentive for primary care. And that's exactly where an Ayurveda doctor, 25,000 doctors passing out every year, they would be gainfully employed with appropriate integration for symptom management in a PHC. So the 150,000 wellness centers across the country could be manned by Ayurveda doctors, because MBBS doctors should go into the tertiary quaternary care. If you look at the fact that NCDs and non-communicable disease, and one very important thing that has happened now, and we're talking about 2030, is with COVID, our health systems have been tested like nothing else. So I believe the government is definitely over the next 5 to 8 years. So far, there have been a lot of speak, not much of spend. Hopefully, the spend will back the speak, and we'll see by 2030 a seamless healthcare system. We must not forget that the National Health Policy 2017 was one of the most progressive health policies we have ever seen, right? It's a pluralistic system. It's far-reaching in terms of data, digital, all kinds of things, vaccines, the works, right? And in the middle of that, the execution is not going really to pace. And Ayushman Bharat, for all the much touted this thing, is really not serving today. Today, it is a suspect in terms of its effectiveness. So we need to bring in what is called early stage prevention, which I'm sure Dimple will jump into in a big way. But secondary prevention, I have the beginning of diabetes. Can I prevent it from becoming advanced? So I want to conclude by telling that Ayurveda would effectively enable an Indian model, not a copy of an American or a British or a Cuban, but an Indian model to evolve, which is truly representing the aspirations of the common man, right? We cannot just forget and look at the digital spend and some technologies. The common man is still deprived of that. And when we look at big data, which is a big thing that is going to happen, right? And we should not forget the fact that the nature of what data do we collect, what is the quality of data, because people are just salivating over big data in India. And the fact that we still don't have a regulation for collection of data, sharing of data. No state government shares data between states. Central government doesn't share with the private sector. So you've got to have standards for sharing all of this to come. And all of this potentially will lead to a clinical outcomes and value-driven healthcare, which will be based on modern medicine appropriately integrated with Ayurveda. I will pause here and come up later. Thanks.
Wonderful, Rajiv. I think some very important themes that you've outlined, connecting the potential for Ayurveda to scale, especially in primary health centers, the potential for what could be a very interesting way to connect an Indian approach, a very uniquely Indian approach. And if I can make a very crude analogy, Indian infrastructure, if you look at the highway system, India is a country which has gullies and also has, the Yamuna Expressway and everything else in the middle, right? And if you really think about our healthcare system in a similar light, you have the small primary health center in Tier 3 India, and you also have large tertiary care chains and everything else in the middle. And I think it's a truly integrative approach. If Ayurveda, as you rightly said, can turbocharge some of the physician capacitization issues, and equally importantly, the protocols that you mentioned from a prevention point of view, and from a level 1 and level 2 wellness point of view, right, which is important. Thank you for that. Dimple, would you like to share your points of view, especially coming at it from a diagnostics angle and what that might mean for our nation?
Definitely, thanks. Thanks, Rajiv and Gagan. Since primarily I work with cancer patients, and what I'm going to share is also applicable for other patients or all other chronic illnesses as well. Before we begin, I wanted to share the definition of integrative oncology given by Society of Integrative Oncology. IO, which is an integrative oncology, is a patient-centered, evidence-informed field of cancer care that utilizes mind and body practices, natural products, lifestyle modifications from different traditions, alongside conventional cancer treatment, which is the medical treatment. IO aims to optimize health, improving quality of life and clinical outcomes across the cancer care continuum, and to empower people to prevent cancer, prevent other chronic illnesses, and become active participants before, during, and beyond cancer treatment. So when we talk about integrative cancer care, integrative medicine, that means combining both modalities of treatment together. And especially when we talk about cancer, which is a very serious illness, because still date there is no standard cure yet. And one needs to see what all options do I have to really find out my own path of healing, my own path of cure. And when we talk about year 2030, there are many possibilities and opportunities for Indian economy, and we are going to discuss a few. So when we talk about complementary and alternative medicine, the term is known as CAM. One thing which we all need to see is, can we really integrate this into the standard medical practice? Because that way, hospitals are everywhere in India. We will be able to provide this to our patients and to a common man in a very distributed manner. So simplifying patient experience with a combined offering through strong and seamless integration among healthcare providers. We talk about the early detection, and we know that in cancer, in India, more than 70% patients get diagnosed in the late stage, which is the 3rd and 4th stage. And if somebody gets diagnosed in the early stage, which is 1st and 2nd stage, still in more than 70% of the cases, there is a chances of recurrence. And that way, there are more than 80% patients living with stage 4, where cost of treatment is very high and the chances of survival are very low. The prognosis is not good. And this all can be avoided, lives can be saved, the treatment can be changed, and many other options will get open for patients once we focus on the early detection and diagnosis. The way we break this entire cancer journey is into 3 parts. One is the early detection, prevention, and screening. The second is the during the treatment, which is the integrative oncology, where we combine medical and CAM treatment both together. And the third one is palliative care. Today, when we see in India, all 3 segments are untapped. A lot of advancement has been done from the medical front, but when we talk about the preventive side, like Rajiv mentioned, or we talk about the during the treatment integrative side or the palliative care side, not much advancement has happened. So when we talk about the early detection, there are many techniques that are coming now. When you talk about there are circulating tumor cells, but even there is one more V cell. So that talks about with just 5 ml of sample of blood, we will be able to detect multiple types of cancer treatment, cancer types together. Today, what challenge people face is that, okay, for colon cancer, it's a colonoscopy, there's bronchoscopy. For different cancer, there's mammogram, there is a pap smear. What all tests should we go for? And hence, I think these kind of advancement will really help people to do the early diagnosis, and more awareness will also happen. In India, only 24% of healthcare workers practice a very simple self-breast examination test. So more and more awareness is definitely needed on that front. When you compare India and US, in US, the rate of cancer diagnosis is much high compared to India, but still the chances of survival are high. The prognosis is good because of the focus that's been given on the early diagnosis and prevention. So I think that focusing on the early detection can really save lives, improving quality of life, better prognosis, and also reducing the burden of the cost also for the treatment, not just for cancer, but maybe diabetes and other chronic illnesses as well. And we talk about the integrative medicine. There are many practitioners from the different CAM field, which they are focusing on this, and there are many scientific based scientific informed therapies also available out there, and there are thousands of research papers also on this. One more thing that we all can focus on is in spreading more awareness with the medical practitioners about integrative cancer care. And it's medical and the oncology should also understand that their patients are already doing integrative care, because in chronic illnesses, you know that there might not be any cure. So you need to find out what all things you can do. Keeping an open mind is very important, and also avoiding assumptions. Many times we see when we work with medical practitioners that there are many assumptions. So it's important that you clarify those assumptions so that we can together plan the entire treatment part for the patient. At the same time, referring to the journals and scientific papers for the complementary and alternative medicines when it is when it's appropriate. So this is, I think, this is gonna change the way we look at the cancer care, or for that matter, the entire chronic care as well. And gene editing to cure multiple type of diseases, including cancer, is what we can envisage 10 years down the line. And what I strongly believe that given all the development and advancements that are happening in the field of healthcare currently in India, I believe it's going to be a very exciting journey by the time we reach year 2030 and beyond that, with very heavy focus on the innovation, discovery of new drugs, stronger clinical backing of integrative approaches. That's something that we all need to focus on, because when we are seeing with hundreds and thousands of patients where they have recovered, they have extended their lives. So generating more and more data around their patient journey can also be a great addition to this integrative medicine. And definitely it shall open new doors, new opportunities, new possibilities for a variety of participants in the Indian healthcare economy, including pharma, insurance, medical professionals, students like all of you who are looking to make a career in the field of healthcare, and most importantly to our patients for whom we all work and think of new technology, new research, new innovations that we can bring. Because many times in chronic illnesses, patients might not have 10 years of time, might not have 5 years of time to live and then wait for this innovation to happen. So whatever we need to do it right away. And I think this is the best time to, and we see a lot of advancement has been already happening. So thank you for discussing on this topic, which is very much needed in today's time. And happy to see the great people working on a great cause for a common man. And I'm sure that in 10 years down the line, we'll see wonderful advancement happening in the field. So thank you so much.
Thank you, Dimple. So just to help manage time, maybe Bhargav, if I can request you to share some views, and we know you have very interesting views of how the Western world has actually, taken non-Western approaches to medicine and integrated them, which maybe we can learn from. There's nothing wrong in learning from them. So if maybe you can talk a bit about that, that'll be great.
Yeah, no, thank you again. As I was saying, we're living in a very interesting time, thinking about health and medicine, unlike, probably in recent history. But vaccines have always been kind of like the bright spot in modern medicine or Western medicine or allopathic medicine, simply because they represented a prevention approach to disease. And that's what drew me to this area. As I said, I'm an engineer by training and an entrepreneur by career. But really it drew me to kind of the tremendous advancements that we have had as humanity to be able to contain or eradicate polio from our own country and mostly from the whole world, and also smallpox and several other use cases or cases where vaccines have really prevailed in benefiting humanity. So that's what really drew me to this. But as an engineer, not as a biochemist or as a life scientist or a physician, I came to this with a different kind of mindset of first principles, perhaps that will resonate with people in the audience, and also the roots and the wisdom of what Rajiv was talking about from an Indian perspective in terms of prevention. We have a heritage and a body of medicine that we truly should be proud of in representing to the whole world. and it is almost our duty to do so. But we have my focus has really been pediatric population. What we uncovered through lots of research with brilliant partners, and I would be amiss if I did not acknowledge that this would never be without the work of Professor Emma Padman at Carnegie Mellon University, or Liana Gefter and such at Stanford University School of Medicine, and Amanda Bruce at Kansas Medical Center, which is where the project really began, because she was doing some of the world's first fMRI studies on children, really trying to understand from a neural perspective what was actually going to lead to a risk of diabetes, heart disease, hypertension from a very young age. And we had some really fundamental discovery that the brain itself the structure of the brain, the physiology of the brain, the responsiveness of the brain was actually a strong predictor of whether a child would end up with diabetes or pre-diabetes and so on and so forth. This breakthrough itself led to publications in pediatrics and social cognitive affective neuroscience, some of the top journals. But we realized that we could actually stimulate the brain using deep brain stimulation through technology that would lead to kind of strengthening the brain and triggering these neural pathways leading to the gut and reconstituting the gut biome, and therefore boosting the immune system. So digital vaccines are non-invasive. And one thing I wanted to add to what Rajiv had said is that the common man may not yet have access or be able to access healthcare. But the one thing that the common man seems to have access to today, and this is a universal phenomenon, is technology, whether it's smartphones or mobile devices and things like that. That is, I think, stunned most people in terms of how quickly that technology was adopted. Because in 2010, when we started working on digital vaccines, and we took a bet that smartphones and software delivered via smartphones could actually be vaccines of the future, without needles, without biologicals, without anything ingested. But we could literally induce better health through neuromodulation in this field of what is called neurocognitive computing. So through the brain-computer interface powered by deep learning and machine learning and things like that, we're actually able to induce at a biomarker level, improve antibodies, improve kind of the gut biome constitution, fatty acids in the gut, and WBCs, and also prevent from a diabetes delay diabetes, whether it's A1C numbers, glucose response. We could do that without invading the body at all, and we could do this by starting in childhood. Now, this was seems like a revolutionary approach to medicine and technology, and we've been very fortunate that we've been able to evolve this field over the last 10 years in collaboration with some of these renowned institutions and scientists. But it's been a slow, gradual process. 10, 11 years is what is par for the course when it comes to vaccine development. mRNA editing technology, which has given the world, or the Western world anyway, a solution for COVID, was again in the works for decades before it really had its moment. We feel like neurocognitive computing, because we've created a candidate that can actually, we've shown can prevent COVID and infectious diseases without putting anything into the body, and by reconstituting the gut biome and boosting the immune system. Again, these are ideas that we draw from principles in Ayurveda, in yoga, in a lot of our own ancient wisdom, which I think we should embrace and combine it with technology, because that's the ultimate distribution channel for us to solve not just an Indian problem, but a global problem. And technology also allows us to personalize this for N of 1. So the actual intervention gets kind of delivered in a highly precise, personalized way, whether a child is in San Francisco or in China or in Chennai or in Bangalore or in Mumbai. It kind of really gets to be much more precisely tuned for that particular child, for their risk factors and so on and so forth, and delivered purely as software. The engagement that we have built around this, the front-end engagement, is all through, based on consumerization of medicine, or the concept of consumerizing medicine. So it's a lot of it is gamified virtual reality and augmented reality technology that does the deep brain stimulation. But I just wanted to not lose Gagan's point, because one thing that has led me down this path over the last 10 years of scientific exploration, and now we're at that exciting stage of translating this research and delivering real impact at global scale, was being able to work with folks like people at Stanford School of Medicine, where I serve on an advisory board, and at Carnegie Mellon, where I'm the partner for research translation at the center that we've created called the Digital Vaccine Project. But we're really seeing kind of a rigorous validation of some approaches centered around yoga and Ayurveda and the gut-brain axis and pranayama and things like that are even being prescribed as part of protocols as part of what is becoming mainstream for integrative medicine. At least it's offered as a choice at Stanford Stanford hospitals. But I think this is something that we should embrace much more, given our roots here in India. And I guess a wisdom that we've been really blessed to have. But to be able to codify this, to be able to create this into technology that can scale and address kind of humanity's problems is our duty. So with that, I kind of wanted to get back to the panel and have a discussion. And again, thank you for having me.
Wonderful, Bhargav. Thank you. Thank you so much. I'll try and just integrate some of the themes we heard, and then we'll get into some of the Q&A. We have some good questions coming in, from the audience. I think, if we think about what we've heard from the point of view of how Ayurveda can help scale the healthcare infrastructure in the country, to how, digital vaccines can be an amazing way to scale up distribution. And everything else in the middle, whether the technology is diagnostics, whether the technology is data and artificial intelligence, something that I've been working on in my career right now with Exacta. Power of what is possible, especially if early stage detection is driven, let's say, for example, through Anganwadi workers, right? I mean, it's a great way to scale up early detection. I believe that, there are multiple angles of how integrative approaches can help India really drive a scalable healthcare infrastructure, which is evidence-led, uniquely Indian. If Stanford hospitals can be prescribing pranayama, why can't we? I mean, it's a very interesting, question to ask ourselves. And whether it is pranayama or other approaches, they have a very important aspect in the prevention of diabetes, or in the prevention of, let's say, pre-diabetes becoming diabetes, and so on. And to Rajiv's point, it's an excellent point that it's not just the number of people, it's also the chronic disease burden. And many of us here are engineers, right? And if you think from a exponential curve point of view, this is like, one exponential curve on top of another exponential curve. So this becomes very scary when you start looking at, what's happening from not only comorbid, potentially trimorbid and quadromorbid patients. I mean, I currently work with patients who have combinations of, dementia and Parkinson's, or Parkinson's and bladder cancer, and so on and so on. I mean, what we are uniquely underestimating in India is the disease burden is going to be exponential, if that is even a word. And I think the strain on the healthcare ecosystem is going to force us in new ways to be more integrative and more integrated, whether it is data, the use of data to predict things, right? Whether it's the use of Ayurveda doctors in primary health centers, whether it is early stage detection, let's say, for breast cancer through Anganwadi workers, or it is, my 12-year-old nephew getting a digital vaccine from Bhargav's company someday. I think this is a very exciting future. There's a couple of very good questions that are coming in. So with the panel's permission, I'll just read them out, and maybe any one of you can jump in and answer if you feel passionate about the question being asked. Just give me 1 second, please. Ravi from our audience has asked a question saying, integrative medicine to all means content and info in Indian vernacular languages. I think that's a great point. Would love to hear the panelists' views on how this can be accomplished in a timely manner and at scale. Anyone would like to take that?
So regarding integrative medicine and Indian vernacular languages, I'm not too sure whether that is the correct linkage. But the fact that when you're looking at reaching out to 1.5 billion people, you need to have vernacular languages. So the front end necessarily will have to become more and more vernacular driven, but the back end could be in whatever language that we seek. So I think this is certainly something which will happen in the next 3 to 5 years, not too very far away. And one connected thing which I just wanted to say is with the NDHM coming in and the unified health interface, like the unified payment interface, that's going to really open up tremendous opportunities for all engineers to really ride on this architecture and platform to produce customized solutions. So that would be my answer.
I think, Rajiv, that's a great point. And if I can add to that, I do a lot of work, with the NDHM infrastructure, trying to learn from it. And I think both from a vernacular point of view, the NDHM sandbox, as it's called, offers a great architecture, Ravi, on the ability to do vernacular, pretty much from the get-go, pretty much instantly, whether it's Gujarati or let's say it's, Malayali. Either way, you are able to get a very natural feel for vernacular experiences. And this is not just basic NLP that some of us learned at IIT, right? This is kind of, NLP on steroids, if you will, in real time. So, it's accent sensitive, it is language sensitive, it is pin code sensitive, believe it or not. So it picks up, different levels of Malayali, whether it is in one part of Kerala or the other part of, let's say, Delhi, where there's a Malayali person speaking. You'll be amazed at what the NDHM sandbox can enable. I'm not sure how much of it will necessarily happen in the next 3 to 5 years, but hopefully it will happen, because a lot of this is going to be very data dependent. Unfortunately, as we all know, ultimately, whatever you want to predict, you're going to need a lot of data, and whatever you want to customize and get it to a segment of one, you again need a lot of data to drive that. So thank you for the question. Wonderful question.
And Gagan, on the similar lines, like, in India, there are 122 major languages and 1599 other languages. And some studies say that this all can be covered majorly into 13 languages. So to make integrative medicine more easily accessible, a great jump can be received through AI/ML based linguistic approaches, as well, as you rightly said. And even though AI/ML is evolving with respects to vernacular languages, there are many human efforts also being made in this direction. So we are maybe a couple of years down the line, we can see a great move in this direction. And also data and intelligent interpretation will help to reduce the time required to even reduce this gap even further. Yeah.
And I think, Dimple, I can even see a day when some of your counselors, would be able to extend themselves digitally automatically in multiple languages, maybe the 13 main languages that you spoke about. And you don't necessarily have to develop that, at zenonco.io. As long as, let's say, zenonco.io can plug into the NDHM sandbox, you will get it right out of the bat, right? Which is a pretty amazing, experience. So let me also offer another question that came in through the audience. Vivek Joshi makes a point. He's saying we have close to 8 lakh Ayush practitioners in a country short of doctors. Ayurvedic doctors' curriculum is almost 90% same as that of MBBS doctors. What needs to be done to get this large workforce deployed in synergy with allopathic doctors? Rajiv, I think this one's for you.
Quickly reduce the percentage of that, whatever percentage that Vivek says, make it more Ayurveda driven, because we don't want to produce mixopathy doctors. We want to produce solid science-based Ayurveda doctors who are familiar with diagnostics, knowing with anatomy. So I think we need to, in some of the colleges in some parts of India, you get a larger emphasis on modern medicine, which is not the case it should be. It should be really balanced towards the core science, with appropriate modern this thing. That will lead to better integration, because the whole effort is this sense of threat being perceived, and that also answers somebody else's question, that perceived threat that somebody's going to eat into my earnings, and that has to be separated. Telling Ayurveda has got its clear field of play, and you got modern medicine which has got its field of play. Both can survive and flourish in a country really deprived of good healthcare.
Thank you, Rajiv. Another question which I think is very interesting for us to discuss as a panel, and maybe with everyone's permission, I'll try and answer this. Nilesh Kumar Pandit asks, what do you think is the scope of medtech diagnosis and digital management of diseases in 2030? In the disease life cycle, at what stage medtech devices will play an important role? I think this is a wonderful question, because medtech is a huge opportunity, to take the homes of 1.3 billion Indians and make them healthcare delivery centers, right? And if you really combine the power of what medtech can do with, let's say, point of care, diagnostic devices, for example, with digital, and if we can deliver digital vaccines, why can't we have digital, disease management programs or digital wellness solutions that are in place? I mean, one of the things that I did in a former life at Apollo, and which I've also learned to apply in my new job at Exacta, is we were managing about 30,000 diabetic patients through connected glucometers pretty much round the clock. And a lot of the data was being driven directly through the cloud. It was being analyzed on the cloud through AI/ML approaches, and it was being segmented, segmented into different cohorts of risk levels versus interventions that are needed, whether they are digital in nature or possibly in person at a consultant's clinic, right? And this was being done, in 2018. So imagine what the talent of IITs and other places will produce by 2030. But personally, I believe, and we're doing a very interesting experiment here in the US, right now, where we actually have point of care ECG machines being used for post-discharge cardiovascular patients. Let's say somebody gets a stent, somebody has a long QT and actually had an inpatient procedure done on them. We actually have a real-time closed-loop environment that we are testing at a fairly small scale. This is 200, 300 patients right now, so not a billion people. But we are testing this environment where ECG, as you know, is the holy grail of diagnostics. Right? One ECG throws off at least 1,200 to 1,300 data points. Right? You start multiplying that, with multiple population levels, you can start seeing. It can be a very powerful way to manage readmissions, for example, and isolate which people need to be handled in a different way versus potentially others who are doing fine for those 5-7 days, which are very critical post-discharge. Wonderful question. I think there's a lot that can be done. Anybody else wants to add anything?
So I just wanted to add real quick, digital medicine or digital therapeutics are already emerging as a category, right? Like the US FDA actually has a regulatory pathway for digital therapeutics and digital medicine. So digital vaccines falls under, that umbrella or that category. But really this convergence between technology and medicine is real. It's already happening. There are cases of companies that are specializing or delivering FDA-approved software for treatment of disease. They're very specialized, but every one of these companies or innovations are using different modalities. A lot of it data-driven, technology-driven, but the piping and the infrastructure of technology, which is what I was alluding to earlier, whether it's smartphones, whether it's internet, whether it is 4G, maybe 5G, 3G networks, and the app stores, and all that infrastructure is already widely available and across the world. So how can we harness all that technology to deliver either a therapeutic via technology in the home, as Gagan was saying, or a vaccine on a mobile device that can get an update to to treat every variant of the coronavirus, is possible as well. So how can we even think of, technology like that, generalized and proven in the same rigorous way as, phase 1, phase 2, human subject trials, published evidence, FDA medical grade kind of rigorous scientific randomized controlled trials, double-blinded placebo-controlled trials. So that's the language of medicine. That's what medicine kind of rests on. And that's very important even as we create technology to measure up to that level of standard. It should be safe, it should be effective, it should be generalizable, it should be reproducible, and then it should meet this regulatory bar for safety and effectiveness. And I think as engineers, we can all respect that data is valuable. We can't run experiments without validating hypotheses. So it's in our blood to think of validation or in our mindset. But that's how we have to prove the solutions that we create for it to have, global relevance and then scale potential.
Wonderful. I think we are almost out of time. I'll check with the IIT Alumni Association, but I think wonderful discussion. Thank you to the audience for asking some excellent questions. Rajiv, Dimple, and Bhargav, you've been very, very helpful in sharing a very unique point of view to the team. So thank you. Devesh or Chintan, should we be wrapping up now, or are we done? Okay, I think we're done, guys. Thank you very much.
Great to meet everyone. Thank you. Bye-bye.
Thank you so much.